Everybody for coming today. We're here today to honor we're going to celebrate the second anniversary of the Affordable Care Act. There's a lot of people who are attacking it, and we're going to tell about all of the good things about it.
Let me just say that it's important that we're having this discussion because it's important that we set the record straight about the Affordable Care Act. You watch what the opponents to proper health care are doing, and in particular all of the Republicans, and certainly the Republican candidates for the presidential election, Republican candidates for Senate and for the House of Representatives, even Republican candidates at the state or local level, keep, in many ways, misrepresenting the Affordable Care Act. And the reality is the Affordable Care Act does lots of good things for seniors. And I'm going to run through just some of them. That it strengthens Medicare. One of the ways it strengthens Medicare, and you'll hear these right-wing nut jobs talking about how the president is taking money out of Medicare. What the president has done is he's negotiated and had his people negotiate with the people who provide Medicare support, whether it's hospitals or others, a set of fees that would make it more affordable. And for the first decade, it saves $450 billion out of Medicare that was being extracted from people who are gouging. And by eliminating gouging doesn't mean that you're making Medicare less accessible. What it means is you're making it more accessible. You're making sure that the Medicare Trust Fund has a longer period of solvency versus insolvency. And I think that it's important that all of us that care about this be out there telling the truth. It closes the donut hole in Part D for prescription drugs that helps every senior. It improves prescription drug coverage for low-income seniors. It again improves the Part D program for seniors. Improves preventive health care services for seniors. Improves overall health care. It makes necessary changes to the Medicare Advantage plans. It cracks down on Medicare fraud.
35,820 people have saved slightly over $156 million on buying their prescription drugs. I calculated that ends up to about $700 per person. They were able to save that much on their prescriptions. 1.5 million people receive free preventive services. That was something before that they either had a copay or a deductible, so now they can go in and get their tests, especially mammograms. I'm a 26-year breast cancer survivor, all right? And it's a testament to early diagnosis, believe me. Get in there if you have any concerns. Get in there routinely and get at least a base mammogram. 4,582 people in Pennsylvania have gone into Fair Care, which is the plan that's set up for people who have pre-existing conditions. I got a chance to talk to Erin today. When it was first initiated, the premiums were slightly under $500, but they lowered them, and today they run $281 for people with pre-existing conditions to get their care.
It's important that we understand that this is the second anniversary. This is the second anniversary of the Affordable Care Act. I've just gone through what it does for seniors. Think about what it does for families. Think about what it does where the insurance company can't come and kick you off now all of a sudden that you're sick. They're ready to insure you when you're not sick. But when you were sick, they'd say, excuse me, you've reached the limit. Or think about now how they can't deny you coverage for a pre-existing condition. Think of all the stories we were hearing 3 years ago, 4 years ago, 5 years ago about people who needed health care and they couldn't get it because they had a pre-existing condition. Think about a steelworker that worked in a plant for 5, 10, 15, 20 years, got laid off. And because he worked in the plant, he had something wrong with his hand or his back or he had an injury. And all of a sudden they say, well, you're not going to be able to get insurance. That's gone. Think about the kids that go off to school. And while they're at school, they weren't able to get insurance. And parents were hoping and praying that the kids wouldn't get sick while they were away at college, because then they'd have to make a choice between college and health care. That's been taken care of. They can't deny those kids coverage.
I was asked to say a few words. about how the Affordable Care Act will help someone in my situation. When I became unemployed, I decided to take COBRA, which meant there wouldn't be a gap in my coverage, and also I would have the same insurance coverage that I did when I was working. And one of the main reasons I did that is that because I had a health scare about 7 years ago where I woke up one morning and I was rushed to the hospital and they found a spot on the MRI. There was a spot, there was something in my brain. I was lucky, it went away, and now there's nothing in my head. But I couldn't take that chance. But the problem is that having COBRA and paying $520 a month and being on unemployment, I can't afford to go to a doctor. And I actually make too much on unemployment to be part of a sliding scale at a health clinic. So the Affordable Care Act would make sure that I could go to a doctor and make sure that I wouldn't be worried about this pre-existing condition.
We really need to control healthcare costs. That's the big problem behind everything. They say that if we don't do something with healthcare, off like in 2050, our entire budget will be consumed by healthcare costs. The healthcare costs go up way higher than what actual inflation, what actual is. So it's good to know that we're working on it. At the beginning of the year, as a senior, we didn't have a COLA for 2 years. So that kept our Part B premium at $96.40 a month. They couldn't raise it as long as we weren't getting a raise. So when we got our COLA this year, everybody sort of held their breath to see what the premium was going to go to. Well, we were shocked. It went to $99.90. It went up $3.50 just over the 2-year period. Now that shows that they're actually starting to help to keep the cost down. They came out probably the middle of last year and said that the insurance companies, the small insurance companies, had to put at least 80% of their money into patient care. That meant that that would keep a lot of the CEO compensation, the advertising and things within check. For the larger insurance companies, they limited to 85%. So these are actually helping to keep the costs down. To show you, just recently, CMS announced that some of the insurance companies in this country failed to keep that ratio. And right now they're looking at $1.4 billion should come back to the recipients in the company. So they're trying to fight it. They're going to their lobbyists and trying to do things to get away from it. But it actually shows that they do need to be checked. So that's a great news.
Thank you so much, and thanks everybody for being here today. I'll be real brief. I want to talk a little bit about the Affordable Care Act and how it's specifically there to give help and hope to the working people who, as we speak, are falling through the cracks of our broken healthcare system faster than ever before. Who are these people? They're people like Wilma, a 55-year-old school bus driver from Butler, whose chronic health condition, diabetes, and age 55, put a target on her back with insurance companies. She's vulnerable to being denied coverage outright or facing impossibly high premiums. There are people like my Aunt Donna, who's a domestic abuse survivor, who's working a just above minimum wage job with no benefits. She's 59 years old and literally can't afford to know if something is wrong. The Affordable Care Act gives people like Wilma and Donna and Henry real choices and real protections so they won't have to feel like ticking time bombs, wondering if a serious illness will exhaust their savings or jeopardize their health. In 2014, their coverage will be secure, no matter where they work, how much they earn, or if they've gotten sick in the past. In our new state-based health insurance marketplace called an exchange, insurance companies will have to compete for their business based on quality and value on a level playing field where people can easily compare plans and find one that works for them. They'll choose from the same plans as their member of Congress and get a significant tax subsidy to make sure coverage is affordable for their household budget. All plans will have to offer essential benefits, including prescription coverage, which a lot of folks don't have now. Insurance companies will have to treat people fairly. They won't be allowed to charge Wilma more than Henry simply because she's a woman. Security, value, and real choices. That's what the Affordable Care Act brings for working families. and that's what will be ripped away if opponents are successful in their efforts to undermine our new law. Too many lives and too many livelihoods are on the line for us to let them win. That's our message to Congress on this 2nd anniversary, and we'll keep getting it out there everywhere and every way we can. Thank you so much.